The pandemic was bad news in general for people living with diabetes, but in one sense it's been good news because it's accelerated the transition to a digital future. And that digital future is an essential prerequisite to two things. First of all, integrated care, and second, to registries.
Our EUDF symposium this year was really the reporting of 1 year of extremely hard work on our three strategic forums, namely digitalization, data and registries, and the importance of integrated care in people with diabetes.
It is important to bring it also to countries, and that was the most important call to action yesterday. It's good we work at European level, but we invite all attendees to also bring it back home and talk to their institutions and health ministries.
Oh, there are big challenges, of course. The major challenge is the growing number of people with diabetes, and that is the reason for the EUDF to work very hard. And of course, the challenge is to really translate the messages, the topics, the goals that the EUDF has set through hard work of many people collaborating and trying to identify strategy to the policy agenda, and to get the policy maker involved in this. And I think the EUDF is also instrumental for one thing, because we needed to unify Europe and the treatment across Europe for people for diabetes. And I think one of the goals for the EUDF is also homogenization of a treatment, management, screening for people with diabetes.
They're making an absolutely compelling case for the benefits of digitalization. Well, if you go around the halls here, what you hear from everybody is that they're waiting to hear the consensus statement from the EASD and ADA on the management of hypoglycemia in type 2 diabetes. We've had type 1. We're really looking forward to the type 2 guidelines.
I mean, there's a lot of science, of course, within GLP-1, which is a particular interest to me. And of course, the guidelines on Friday, the updated ADA ESD guidelines, I'm looking particularly forward to see if, how we progress the innovation.
Guidelines are very important in terms of ensuring you reduce variation in practice. So it's important to have well-constructed and valid guidelines for any disease, actually, not just diabetes, type 1 or type 2. But it's important to be able to implement those guidelines also in clinical practice. The ESD recently launched a project to produce guidelines in terms of using appropriate methodology. So we are aiming to produce guidelines that use great methodology, that are based on systematic reviews of the evidence, and that they are constructed, they are written by multidisciplinary panels that take into consideration geography, gender, that they are balanced, and so that they can actually reflect the thoughts and the needs not just of one country, but rather across Europe or even across the globe when it's an ADA ESD document.
Tomorrow sees the launch of the EASD-ADA Joint Consensus Statement on Management of Hypoglycemia in Type 2 Diabetes. It's a very important statement, and of course it's now available to everyone whenever they want to see it, whenever they want to discuss it, thanks to both the e-learning platforms provided by the EASD and this hybrid meeting, which doesn't live just now and in the present moment, but lives right through the year whenever you want to access it, whatever time you want to access it, and in whatever part of the world you are.